Why is MRI used for pancreatic pseudocyst evaluation? Imagine trying to see the tiny details inside a complex puzzle. That's what MRI does for pancreatic pseudocysts. It provides highly detailed images that help doctors understand exactly what's happening inside the pancreas. Unlike ultrasound or CT scans, MRI offers superior contrast resolution, making it easier to distinguish fluid-filled areas from surrounding tissues. This is especially important because pseudocysts are fluid collections that can vary in size, location, and internal makeup. MRI can accurately measure their size and pinpoint their exact location, which is crucial for planning treatment. One of the key strengths of MRI is its ability to differentiate different types of tissue within the pseudocyst. For example, on MRI images, pseudocysts usually show low signal on T1 weighted images and high signal on T2 weighted images. This helps doctors identify the fluid content clearly. If there is bleeding inside the pseudocyst or thick, protein-rich material, MRI can detect these features because they change the typical signals. This level of detail is vital because it can reveal complications like hemorrhage or infection, which might require different management. MRI also excels at showing debris or complex fluid components inside the pseudocyst. This is important because solid debris or thick fluid can increase the risk of infection or other issues. Unlike CT scans, MRI can better visualize these details without exposing patients to radiation. This makes it safer for repeated imaging, especially if ongoing monitoring is needed. Another major advantage of MRI is its ability to visualize the pancreatic duct without invasive procedures. Using a special technique called magnetic resonance cholangiopancreatography, or MRCP, doctors can see if the pseudocyst communicates with the ductal system. This information helps determine whether the pseudocyst is related to ductal disruptions or leaks, which can influence treatment choices. MRI is also safer for patients with kidney problems because it uses less nephrotoxic contrast agents compared to CT scans. Plus, since MRI does not involve ionizing radiation, it is a better option for follow-up imaging over time. This is especially helpful when doctors need to monitor the pseudocyst for changes or to check for recurrence. In the context of pancreas health and pancreatic cancer, accurately identifying and characterizing pseudocysts is very important. Some pancreatic cystic lesions can look similar but have different risks of becoming malignant. MRI helps differentiate pseudocysts from other cystic tumors by revealing features like wall thickness, septations, nodules, and connections to the pancreatic duct. This detailed information guides doctors in deciding whether to observe, drain, or surgically remove the cyst. While ultrasound and CT scans are often used initially because they are quick and widely available, MRI provides more detailed information when the diagnosis is uncertain or when complex features are present. Endoscopic ultrasound can also be used to sample fluid from the cyst to rule out cancer, but MRI remains a key tool for initial assessment and follow-up. In summary, MRI is used for pancreatic pseudocyst evaluation because it offers detailed, non-invasive, and radiation-free imaging that improves diagnostic accuracy. It helps distinguish pseudocysts from other pancreatic cystic lesions, detects complications, and guides appropriate treatment. Always remember to consult healthcare professionals for personalized advice, as each case can be different.